This is a presentation from Lazy Cat Productions, Marsha Sortor, producer. This presentation is for the course HCA 213, Medical Law and Ethics. This will present a scenario of possible HIPAA violations. Sally works in a very busy physician's office. It is Sally's lunchtime, and she is meeting a new boyfriend for lunch and is very excited about that. However, as she leaves for lunch, Sally forgets to log off of her computer. While Sally was out to lunch, Mike was passing by her workstation and discovers PHI displayed on Sally's computer screen. Oh no, he thinks, this is not good. However, Sally has access to files that I don't have. I think I'll just go in and check on the test results of my neighbor who was in here yesterday. Later, when Sally gets back from lunch, she overhears Mike talking to another patient in the waiting room, telling this patient the results of his other neighbor's tests and telling this individual how sick this neighbor was and that they should do something to help this neighbor out because he is so sick. Has a provision of the HIPAA regulations been violated in this scenario? First off, I would say yes, there have been some provisions that have been violated in this scenario. What provision has been violated? One of the HIPAA provisions that has been violated in this scenario is the privacy rule, which became effective April 14, 2001. It applies to personal health information, which include but is not limited to information your provider has put into your medical records or any other individual's medical records. This includes personal information, name, address, age, results of any tests, and any physician's notes that may be contained in this medical records. The covered entities in this provision are the provider and individuals who work for that provider. Now let's go back to Sally and Mike. Who is responsible or liable for the HIPAA provision violation in this scenario? They both are. Sally for not logging out of her computer and putting away private information on patients. Mike, because he took the opportunity to look at that information and looked at it at medical information on his neighbor and passed that information on to another neighbor. So Mike is a little more liable than Sally is in this scenario. How do you think Sally should handle this situation? The ethical responsibility lies with Sally because she left her computer open and another individual had access to that private information on other patients. What she needs to do is tell the supervisor of what happened and what she suspected Mike saw on her computer and relay that information to another individual. There's another question that looms with this scenario. Does this scenario violate the ethical guidelines of your professional career? As a medical professional, it does violate the ethical guidelines of all medical professionals. Each are required to adhere to their own code of ethics in which they sign as they enter into the field of medicine in their own capacities. And in regards to patient confidentiality and privacy. It is very important that these HIPAA provisions be adhered to strictly, and it is a violation of the ethical guidelines of each medical professional's code of ethics. HIPAA is the law, and privacy is the right of every patient that we come in contact with in our profession as medical professionals. And I have just one word of advice to each of you. Be careful out there. HIPAA is the law, and violation of that law can get you into big trouble.